Hello YouTubers! I hope you are well and feeling great as you clicked on this video. I wanted to discuss how pregnancy was confirmed before the invention of the ultrasound machine. I have decided to leave pregnancy tests out of the discussion in this video completely since they were invented around the same time as the ultrasound machine. I do plan on making a video addressing the specifics of pregnancy tests and blood pregnancy tests in the future. So look out for that. The title of this video is Before Ultrasound, Pregnancy Confirmation Related to Protracted Gestation. So with that said, let's go back. Now let's say back in the day, around 3,000 years or so ago, when a woman missed her period, she would become suspicious that she was pregnant. She would often start to monitor her signs and symptoms instinctively from this point on. If she missed her period the following month, she would assume she's probably pregnant. As her belly begins to grow and her symptoms strongly persist, she would lean more towards pregnancy and that she was currently with child. When her belly would become rounder and fuller, she would welcome the change as a positive sign. And when she was around 5 to 6 months along, she would start to feel movement from the fetus, which would be the ultimate confirmation. At this point, the baby has become big enough to be palpated by the mother and even the midwife. And evidence of the viable pregnancy is evident from the outside through movement seen and felt from the outside by the mother and by other people, as well as the continuous growing belly and persistent symptoms. By this time, the woman is likely to be well into her second trimester before she feels confident that she is in fact pregnant. Some wouldn't announce official pregnancy until they felt official fetal movement, and that could be as late as the beginning of the third trimester, depending on the woman. So during this time, the things looked for to confirm pregnancy were several consecutively missed menstrual cycles, bodily changes experienced in the woman's body, including a growing belly or abdomen, the eventual movement and kicking felt by the mother, and then eventual movement seen and felt from the outside, and then once baby grew big enough, the palpation of the actual fetus. So if you fast forward in time to the 19th century and the woman does all those same things, except now it is customary to get pregnancy confirmation from a doctor or midwife as well, instead of just making the call yourself as a woman or using help from your mother to make the call of pregnancy. So during this time, when the woman misses her period, she waits until she misses 1 or 2 more periods before she's likely to make an appointment at the doctor's office. At the appointment of the doctor's office, again, leaving out urine and blood because it's not invented at this time yet, the doctor will palpate her abdomen, and if she is pregnant, her fundus or top of uterus is easily located and measured. Then the doctor can proceed with a cervical exam and upon visualization see the Chadwick sign, which is a bluish discolorization of the cervix, vagina, or labia, resulting from increased blood flow. This can be observed as early as 6 to 8 weeks after conception, and its presence is an early sign of pregnancy. The doctor would then conclude that pregnancy is very likely because of her missed periods, symptoms and palpation of her fundus or growing uterus, and the possible Chadwick sign, and that she should come in the following month for more measurements. The woman at this time would go home being told that she is likely pregnant, but a definite yes will come the following month after examination. She will then live her life as if she is currently pregnant until her next appointment. At her follow-up appointment, if her uterus has measurable growth, fundus is palpated, and her period is still absent, her symptoms continue as well as development of new symptoms, it is at this time that she can be medically confirmed pregnant by the doctor. Some doctors also look for the Haggard sign and the Goodell sign, which is a softening of the vaginal portion of the cervix from the increased vascularization. By this time, the woman is likely to be into her second trimester or even almost into her third trimester before official confirmation is given of her pregnancy. So during this time, they would use measurable growth of the uterus, increased size and softening, palpated fundus, continued absence of menstruation, persistent symptoms, and development of new symptoms, and a Chadwick sign, Goodell sign, or Haggard sign in order to confirm pregnancy. A stethoscope was known to be used as a tool in confirmation of pregnancy. It is important to know that this can be a very unreliable tool in searching and verifying a fetal heartbeat because it is not able to be used until the baby is at least 20 weeks gestation. Usually it isn't attempted until the third trimester. It was used for confirmation in the past depending on how many weeks the woman is, the position of the baby, and the doctor's individual skill set in using a stethoscope and finding a fetal heartbeat. Also, the sensitivity level of the stethoscope itself makes a big difference in hearing more than just bowel sounds and air moving through the mother's lungs. A stethoscope to find a fetal heartbeat can be an undependable tool even to the trained professional in a medical setting. Once the Doppler was invented, then a fetal heartbeat became more of an important part of the confirmation process because it can be used as early as 12 weeks pregnant, when a stethoscope isn't reliable until well into the third trimester of pregnancy, and by then the baby can already be palpated. Again, it is important to note that the Doppler does not usually pick up the heartbeat until at least 12 weeks gestation. So the woman would have to have missed 3 consecutive periods in a row for the doctor or nurse to even attempt in finding a fetal heartbeat using a Doppler. At this time, the mother's heartbeat is usually taken radially on their wrist. They would take their pulse. The nurse would take the pulse while a doctor searches for the fetal heartbeat with the Doppler simultaneously, in order to ensure that the mother's heartbeat is not mistaken for a fetal heartbeat. Most of the time, the fetal heartbeat is verified by more than one doctor or obstetrician, hopefully eliminating the possibility of mixed diagnosis or misinterpretation. A fetal heartbeat was then added to the list of confirmation for pregnancy. It was at this time that finding a fetal heartbeat and palpation of the actual baby were very good signs that the woman was actually pregnant. Once the ultrasound machine was invented and used regularly, it was and is seen in today's society as the ultimate confirmation of pregnancy because not only can the baby be viewed, but so can the changing and growing uterus, sac, fetal pole, and fluid. It can also be used to confirm that the embryo implanted within the uterus and if it is a singleton or multiple pregnancy. If an extended gestational pregnancy was possible, it would have had to have happened way more often in the past, before the invention of pregnancy tests, the Doppler, and ultrasound. But for some reason, it has started happening more recently, even more despite the advancement in technology. It doesn't add up to me. I only heard about an extended gestational pregnancy within the last 3 years or so. There are possible signs, probable, and positive signs of pregnancy. Once a woman begins her second trimester, more objective signs are available, but it still only makes pregnancy probable. Once the woman progresses past the third trimester, however, the baby itself is easily palpated as well as the fundus and uterus. A heartbeat is easily found and heard through a Doppler and even a stethoscope. Eventually, the pregnancy gets to a point where it is easily confirmed because baby makes itself known through movement, seen from the outside and felt by both the mother and other people. In today's society, we have the convenience of viewing baby or babies through an ultrasound. The bigger the baby or babies get, the more obvious it becomes that baby or babies are actually there with or without ultrasound. So I hope this video helps somebody in understanding how pregnancy was confirmed before the invention of ultrasound and pregnancy tests. Thank you guys so much for watching. Have a great day. Hope you learned something new. If you have any questions, please leave them in the comments. Be well, be healthy, but most importantly, have fun. Bye.